conducted as a part of neurodiversity celebration. The term neurodiversity reminds us that every brain works differently. So understanding these key differences helps us develop a more inclusive and supportive society. So I really hope today's session will give you all some very valuable inputs and key takeaways. I thank everyone for joining us today. So let's get into the session. I call upon Abdul to provide a brief introduction on today's session.
Good evening, everyone. I am Abdul Aziz from PSP Medical College Hospital and Research Institute, and it's a privilege for me to serve as a moderator for today's session on behalf of the Mental Health Subcommittee of the Indian Medical Association, Medical Students Network, IMA-MSN, Tamil Nadu State Branch. On behalf of the IMA Medical Students Network and Junior Doctors Network, Tamil Nadu State Branch 2026 to 2027, I extend a very warm welcome to all the respected dignitaries, our esteemed speaker, and all the participants who have joined us today for this informative webinar of Brain Come in All Types, Understanding Neurodevelopmental Diversity and its Clinical Implications. At the beginning, I would like to respectfully acknowledge the constant guidance and encouragement provided by the patrons of IMA Tamil Nadu State Branch, Dr. B. Sridhar Sir, State President, IMA TNSP, Dr. P. Sengutwan Sir, IMA Past President, IMA TNSP, Dr. A.K. Ravikumar Sir, President-elect 2026, IMA TNSP, Dr. N.R. Tyagarajan Sir, President-elect 2027, IMA TNSP, Dr. M. Thiravia Mohan Sir, State General Secretary, IMA TNSP, and Dr. D. Solomon Jaya Sir, State Finance Secretary, IMA TNSP. I would also like to convey my sincere regards to our state leadership team, Dr. R. Annamalai Sir, Chairman, IMA TNSB, Dr. S. Jamuna Rani Ma'am, Co-Chairman, IMA-MSN TNSB, Dr. V.S. Hariharan Sir, Chairman, IMA JDN TNSB, and Dr. Kannan Rajendran Sir, Convener, IMA-MSN Subcommittee. And a special appreciation to the state team members who continuously support the activities of the Medical Students Network. Arnagiri Sir, Convener, IMA-MSN TNSB, Ajay Karthik Sir, General Secretary, IMA-MSN TNSB, Bala Hariharan Sir, Co-Convener, IMA-MSN TNSB, and Hariram Sir, Co-Convener, IMA TNSB. Neurodevelopmental conditions such as autism spectrum disorder, attention deficit hyperactivity disorder, intellectual disability, and specific learning disorder are now increasingly understood within the broader concept of neurodiversity. However, despite growing awareness, many individuals with these conditions still experience misunderstanding, stigma, and delayed recognition. As future healthcare professionals, medical students often learn about these disorders mainly through textbooks, with limited exposure to their real-life challenges and social implications. This session aims to bridge the gap by introducing the concept of neurodiversity, highlighting the clinical features of common neurodevelopmental disorders, and encouraging healthcare professionals to develop a more informed, empathetic, and inclusive approach when caring for individuals with neurodevelopmental differences. It is indeed a great honor to have with us Dr. Sivaraman S. Sir, Professor and Head of the Department of Psychiatry at Trichy SRM Medical College Hospital and Research Center. Dr. Sivaraman Sir completed his MD Psychiatry from the All India Institute of Medical Sciences, AIIMS, and has extensive experiences in both academic teaching and clinical practice. Sir has contributed numerous research articles to national and international journals and has actively participated in various academic and research initiatives. Sir is also a member of several professional bodies, including the Indian Psychiatric Society and the Indian Medical Association, and has delivered talks in many academic conferences and mental health awareness programs. Sir's areas of interest include liaison psychiatry, neuropsychiatry, de-addiction, mental health economics, and public mental health awareness. Without further delay, let us begin today's session. I now invite Dr. Sivaraman Sir to kindly deliver his talk and share this valuable insights with us.
Thank you for the wonderful introduction. Am I audible? Am I audible? My voice is audible?
Yes,
Yes,
sir.
Yeah,
you're
yeah, okay.
audible, sir. Yes,
Yeah.
sir.
So I would like to express my sincere thanks to the Indian Medical Association Medical Students Network for providing me this great opportunity to interact with the young brains of the Tamil Nadu State Branch and also the mentors of this IMA-MSN, the whole team, for providing me this great opportunity. So without further delay, I think we'll go for the presentation. And I would like to take any questions if you are raising. Yeah. Can you share the slides? Can you share the slides? Yeah. So this is the present, the topics. Yeah, first slide itself. This is a slide given, topic given to me. That is a brain comes in all types, understanding neurodevelopmental diversity and its clinical implication. So I'm wondering that the concept of psychiatry by itself has reached the young brains of the Tamil Nadu medical team. They are able to look into the subspecialty of the psychiatry, and they are able to get reach out psychiatrists for enlightening a topic like this. So I appreciate the efforts taken by all of you. Going into the topic, so first in the few slides, I'll be discussing about some basic introduction of the neurodevelopmental biodiversity, and then I'll be giving a brief idea about the neurodevelopment, the concept of neurodevelopment, and then I'll be talking about various neurodevelopmental disorders, and then I will talk about the concept of neurodiversity. Then how the neurodiversity concept fits into this neurodevelopmental neurodiversity. So that I will be discussing, and then the clinical implication of this concept into our into the topic of interest today, and finally the management, how this fits into the new concept, that is management of the neurodevelopmental disorders. So we know that even after many long years and centuries, we are still yet to find what the brain is doing. So it is a complex organ within our human body, so that because of its complexity, we could able to understand there are naturally differences in each individual, not only in appearance and behavior, also in cognition, emotions, sensory processing, and social functioning. So because of these natural differences within the brain, it is understood that the outcome of these things, that is cognition, emotion, and sensory processing and functioning, will also be different from individual to individual. So this kind of differences is actually required for functioning of the whole world in a proper ecosystem nature. So traditionally, what happens in the medical model of the medical approach or medical model, what happens if something is not there, then we are labeling it as abnormal, and we are trying to say normal, abnormal as a differentiating point. If these things are there, it is normal. If these things are not there, then it is abnormal. So it is some dichotomy model like that. That is a usual understanding so far we are following in the medical field. So that is pathology based model. If the brain is of this type, then we call it as normal. If something is deficit, we are called as abnormal. So deficit and impairment has been labeled quickly in the medical model. So what happens, especially in psychiatry, we usually follow a model called biopsychosocial model. So if you view the brain as only a biological model, that is brain as a biological concept, then just structural change or minimal functional change can be labeled as variation, and we can say that it is not physiologically functioning, it is pathology. Like that we can able to label. But when we try to understand a human in comprehensive nature, we have to look the person as a biological, psychological, and social aspects. So biological aspect means the function of the individual organ is optimal. For example, let us take heart. Okay. So if the heart is beating 72 beats per minute, we call it as a normal heart rate. But when the heart rate is crossing 100 beats per minute, we are calling it as a tachycardia. So it is not that 73 is abnormal. So there is a range. So 72 is normal. So up from that point of normal, there is a range of normal thing, and then we label as tachycardia when it crosses 100. Similarly, okay, in brain also, in the functioning also, so immediately it is not that if this is there, it is normal. If it is not there, it is not abnormal. Those kind of labeling is not required. So in psychiatry, what we call is biopsychosocial model. So just optimal functioning of a organ or brain is not enough for social functioning. So the structure of the brain, the function of the brain should be as expected. And also the communication, the brain is communicating to the external world by speech and action. So that should be optimal. And that speech and action should be in such a way that it is socially acceptable and socially adaptable. So just being normality in biological or just being abnormally in biological aspect is cannot be measured as normality in the field of psychiatry. So it is more of psychosocial aspect is also we have to consider. So what I'm trying to say here is, if a person is able to function this in a psychosocial, in a given society, if the person is able to function in his own way so that the social structure is not disturbed, then he can also be considered as normal. That is a concept of biopsychosocial. Fine. So probably, so this concept of biopsychosocial model is there for many years in the field of psychiatry. Now the neurological understanding also, they are trying to take this and trying to means for the problem of stigma, they are trying to use this concept and trying to destigmatize the variations in the brain. So newer perspectives recognize that variation in brain functioning are part of normal human diversity. That is a concept here. Okay. So the concept of the neurodevelopmental diversity suggests that these differences represent alternative pattern of the brain function rather than simply abnormalities. Okay, so function of the brain, that is the important thing. If the brain is able to function in such a way, he is able to connect with the world, connect to the immediate environment and to the society, then he can be considered as normal. That is a concept. It is emerging now. That is a neurodevelopmental diversity. Yeah. Next slide, please. So in psychiatry, we usually use the manual called either International Classification of Disease, that is called ICD, or this DSM for diagnosing the psychiatric illness. So in DSM, under the heading of neurodevelopmental disorder, okay, they have given different diagnosis. So broadly, so how they are labeling this neurodevelopmental disorder? So because of the deficit or impairment, if it is affecting the personal life, social life, academic life, or occupational functioning, then it is called as disorder. If these things are not affected, then we cannot call it as disorder. Example of this disorder includes, as already mentioned by Dr. Abdul, so autism spectrum disorder, attention deficit or hyperactivity disorder, specific learning disorder, intellectual disability, communication or motor disorder. To understand simply on these areas, for example, let us understand the intellectual disability. So to make you simple, let us understand the brain as a globe. If most part of the brain function is functioning less than average than many other people, then we call it as a global dysfunction, which usually called as intellectual disability. So many parts of the brain function is less than the average of many other people in the society. Then we call as intellectual disability. So like that. If only a specific part of the brain, most of the brain is functioning or the development is as expected with any other people, but only one part of the brain or one part of the function, for example, only reading is affected or only writing is affected or only a similar small portion of the brain function is affected, but other parts of the brain or other function of the brain is as expected from any other people, then we labeling it as a specific learning disorder. So dyslexia comes under this thing. So another thing is attention deficit hyperactivity disorder, in which there will be, as mentioned, the diagnosis, the name itself clearly explain the two important features of the disorder. So either there will be a problem in the concentration or attention associated with the changes in the motor activity of the child. So because of this attention deficit and hyperactivity, even the intelligence is normal, the child may not be able to attend the class, child may not be able to learn what is expected from them, like this. In autism spectrum disorder, again, so there is they live in a different world, like they could not able to socially connect with the other children's, and there may be some language disturbance, and there may be okay, some repetitive behaviors may be there. So these are some of the features of these disorders. So what this medical model or the disorder model is saying, that if these features are there, then we are labeling it as a disorder. So if it is labeled as a disorder, then there comes a role of the stigma, and because of that they are not allowed in a normal school, or the society is excluding them, or they're seeing them in a different way, so that they are not uh, accepted as normal in the society. So these are the things going so far before the concept of neurodiversity. So after the concept of neurodiversity, these things, how it is changing, that we are going to see in the coming presentation. So I think I have given means the introduction, so that you understand what is the basic concept, right? So if any doubts, I will be able to explain. Yeah. Next slide, please. So now this is a normal neurodevelopment which we are seeing, right? So what happens in the neurodevelopment? Initially, in the prenatal period itself, the neurogenesis starts, during which formation of the neural stem cells will be there. So in next to that, or in along with that, the next step of neuronal migration starts. During this period, the formed neural stem cells from their neurons travel to the specific cortical regions, that is migration of the neurons to the next level. So the third part is synaptogenesis. During this period, there will be formation of the neural network. It is usually gets a peak during the early childhood. Okay. The next step is synaptic pruning. During this time, so selective elimination for efficiency continuing into adolescence. That is synaptic pruning means it is something like a hair cutting. Okay. The brain is formed, the neurogenesis is over, neuronal migration is over, synaptogenesis is over. So final shaping is occurring. That shaping is called synaptic pruning. So sometimes something are kept and something are eliminated. So like shaping the brain or hair cutting like that. So to make you understand, that is synaptic pruning. The next step is myelination. During this period, what happens in the neurons? The axon insulation occurs so that the signals, okay, pass from one place to another. So speed and continuation of these things into the adulthood. So this is the normal process of the neurodevelopment. So neurogenesis followed by neuronal migration, then synaptogenesis, then synaptic pruning, followed by myelination. This is a normal neurodevelopment, what we are expecting, or many of the individuals follow this concept. Okay, next slide, please. Now comes the concept of neurodiversity. So we were discussing about the pathological model. If either it is there, it is normal. If it is going to in a different direction, it is abnormal. That is a pathological model. So here in the pathological model, what is focused is deficits. So strict norm. Okay, either it is normal or abnormal. That is the dichotomy or binary concept. Okay, then that is a pathological model. So you have to cure it. So if you're labeling as abnormal, then the expectation of curing it is coming. So now this Judy Singer in 1990, who is actually a sociologist, okay, he has introduced this term called neurodiversity. As I was already saying, okay, this in psychiatry, we usually follow a model called a biopsychosocial model. So the biological normal may be different from psychological normal. It may be different from sociological normal. Okay, so but for optimal functioning of a human being, just a biological function optimal is not enough. Psychosocial concept is also very important. So when you're looking the function of the brain in the sociological concept, okay, so there comes the a range of neurological or neurodevelopmental thing can be considered as a normal or normal variation. So immediately you cannot look into means jump into the abnormal thing. So before there is a point called normal, and before you're reaching a point called abnormal, there is a range or some distance is there. So that kind of breathing space is created because of the concept given by this Judy Singer. So this concept usually actually emerged from the autism right movement. They later expanded this to include other neurodevelopmental differences, initially for autism, and then for even other neurodevelopmental disorders, they have brought this to the fact. Because I will be discussing about the strength and benefits of the different neurodevelopmental disorders. When I will be discussing those things, you will be able to understand better. So in this neurodiversity model, what happened here? It focused on dynamic unfolding the personal environmental fit and diverse cognitive profiles. Like an individual react to the immediate environment, not in a similar way. Different individuals react to the immediate environment or to the society in a different method. Okay, so if it is not, we cannot expect everything to behave in a similar method like a Xerox. So there are a range of behavior, a range of cognition, a range of emotions could be accepted in the social belief system. So there comes a concept of this neurodiversity model. So deviation from typical development are not merely software faults to be fixed, but alternative patterns of brain function. This social understanding normalizes many of the minimally deviant persons so that the stigma is getting reduced. So we can look that as a alternative pattern of brain functioning rather than labeling it as abnormal. That is a main concept here. Okay, next slide, please. So this sociologist Judy Singer in the late 1990s, okay, given this concept, neurological differences are natural variation of the human genome akin to cultural or ethnic biodiversity. Okay, so like in the social concept, we call it as cultural or ethnic biodiversity, right? So in every part of the world, it is not the same culture we are following. In every in different places, one place it is considered as normal. It's not the same in the next in the another part of the world. So these kind of cultural and ethnic biodiversities are there when we are able to closely follow the human behavior. Like, okay, so what he the even so not only this sociologist Judy Singer late 1990s has given this concept, but when you closely watch the our old Tamil literatures, so there are many understanding like this has been given even before 2000 2500 years back. These kind of concepts uh, has been there in a different method. Like we used to say, like Yadu Mure, Yavarum Kelir. Like the whole world is ours. Whoever the person in the whole world are our brothers and sisters, are just we are related. So they are not different from us. So this particular word is trying to make everybody, the whole world, the whole human being in one umbrella. Okay, so that we are not finding much differences. We are just seeing them as a brothers and sisters. So it is not only in sociological concept, in all the ways. So that is one attempt to uh, trying to make everything is one or other related. Everything, everybody is important. Those kind of concept were there. Okay, and there are concept called Ellorum Innattu Mannargal, right? So Ellorum Innattu Mannargal means so the belief system, the ability of an individual may different from person to person. The skills may be different from person to person. Okay, but we can broadly say that everyone have a role in this world. Okay, everybody can work together. Everyone can stay together. Everyone is a boss. Everyone is helping others. So these kind of concepts are there. Okay, for many years ago. So now these are the documented concept of this. Judy Singer is given this idea. Okay, okay. Next slide. So why this neurodiversity concept is important? That is very important. So what are the main principles of this neurodiversity? So in the concept of neurodiversity, any difference in the neurological patterns are seen as a natural variation of the human genome. So it is not considered as abnormal. It is not considered as unnatural. That is the main understanding. Next, this brain diversity is comparable to other forms of diversity such as cultural or ethnic diversity. So just we were discussing about everybody in this world have a different okay culture and different language and different belief system, but together we understand that okay, we are all human beings. Okay, that is the main concept. Fine. So மனிதமாய் ஒன்றிணைவோம், அனைவரும் மனிதர்கள் தான். So the concept like this is trying to make everybody come together. That is the main understanding. So disability often arises from the interaction between the individual and the environment. Okay, so most of the times it is when we are calling it is a disability. Disorder is different. Disability is different. Fine. So disability here mostly arises the person biologically by himself. He may be having some deficits or impairment. That is different. But he is able to function like any other human being. He able to in many areas, may not be in few areas. So when the given individual is interacting with another individual, when the given person is interacting with that person in the environment, then only his ability is exposed. During that time, it is means many people are labeling the person as a disability. So this disability is more of a mostly understood as a concept. It's a label given by the environment to that individual rather than the individual to the environment. So that is understanding. So society should promote the inclusion and accessibility. That is one concept of neurodiversity. Okay, so wherever possible, whoever the person nearby you in your society is made up of different human beings, have different abilities. So it is not that everybody, for example, let us assume there is a society, okay, a place, locality place, everybody is having equal ability, everybody is doctor. Let us assume we are a group of doctors. Let us assume Trichy is one place. Let us assume everybody is having the equal ability. Everybody is a doctor. Every family member, every person is a doctor. So let us assume like that. Then how comes the ecosystem develops? If everybody is doctor, then who will do the engineering work? Then who will do the driving work? Who will do the other work? Like that. So everybody's role is important when it comes into the society. Everybody have a different kind of roles, different kind of abilities. If you are not acknowledging the other person's ability, if you are not acknowledging the other person's to your thing, if you are not mutually benefited, you are providing some services to them and you are getting services from other. If you are not doing this thing, this ecosystem will disintegrate, and there will be a gross, it means everybody's survival will become a problem. So wherever possible, society should promote the inclusion and accessibility. That is main thing. This neurodiversity framework does not, this is very important. It is not that this concept of neurodiversity is normalizing all the abnormal things. It is not like that. So it is clearly mentioned that this neurodiversity framework does not deny the presence of impairment, but it argues that social barriers often exacerbate the disability. So I think, so grossly deviant, grossly different, that they may require more support. So this concept is not normalizing that. But because of some changes, some deviation, the society is labeling them so that, okay, it is trying to broaden the normality concept rather than not against diagnosing any abnormal or disorder things. So I think if any doubts, I could be able to answer this in the future if time permits. Okay, these are the main concepts of neurodiversity. Next slide, please. So just to I have discussed about the medical model, and we were discussing about social model and this neurodiversity also. What is the difference between these things? So I think this diagram is self-explanatory. So let us first discuss about the medical model. So medical model is, what is the focus? Fix the individual. So take the individual and find what is a deficit, what is the pathology in that individual, and the goal is either cure that person, make the person normal, or let the symptom get subside. like that. This is the model. Like if somebody is having for respiratory issue, okay, where is a deficit? It's a virus or bacteria, like that. Give the antibiotic or symptom. Well, let this symptom get suppressed by paracetamol or something other. So if the patient is optimally functioning, and then he becomes okay. This is a medical model. Okay. So what is that in the social model? The focus is in the society. So let the individual is not the focus here. The whole society is the focus here. So here the barriers and the environment is a core concept. What is the barriers and environment is there in the society so that they are not coming together. Finding that the removal of the structures and social obstacles so that socially they are connected together. That is a social model. So that is a different concept. Here, the neurodiversity paradigm is slightly different. So here, the focus is to support the individual. Okay, so that he adapted to that society. So that individual is targeted and he making them as a part of the society. That is the focus here. The concept is trying to understand the natural biological variation rather than labeling everything as a pathology or deficit. That is the main understanding. Here, the goal will be like therapies and trying to fit that individual as a normal variation so that the individual is flourishing within the society rather than facing the stigma. That is the main understanding of neurodiversity. I think you could able to differentiate. There are minute differences in the social model and neurodiversity, and if you were able to understand the concept, then you could able to say there is a clear goal is different in the social model and the clinical goal. So we are fixing the individual. We are trying to improve the individual so that he adapt to the society. We are targeting the society so that the individual is included into the society. That is the main understanding. So the neurodiversity paradigm, it does not deny biological differences or support needs. If grossly deviant, if there is a disorder, if that individual requires a special education or special support, this concept is not opposing it. Okay, that is the main understanding you should you should think into. It reframes from the individual defects to systematic interactions. Okay, that is the main understanding. So adaptability, that is the main concept here. Yeah, next slide, please. So when we are understanding the neurodevelopmental disorder or neurological thing, there we could able to see the defects as I was discussing about the normal neurodevelopment. A few slides back I was discussing. There are deficits can occur in different variations. Like if there is a deficit in proliferation and migration part of the neurodevelopment, what happens because of that? The outcome is the microcephaly, okay, megalencephaly, cortical dysplasia are the outcomes. These things occur. So how this occur? How this is occurring? Because of somatic or germline mutation, so that okay, neuronal migration or proliferation is getting altered. So this is one deficit. The another thing is another possible deficit is deficit in connectivity. Okay, because of that, autism spectrum disorder, attention deficit hyperactivity disorder, intellectual disability occurs. So what connectivity, how this connectivity is getting altered? It is because of hypomorphic alleles or post-migration synaptic signal variation. If this is there, then what happens? This ASD, ADHD are the outcome. So what we are trying to understand here, the disease of connectivity manifests before defective neuronal differentiation. So it causes gross structural abnormalities, highlighting the brain's incredible plasticity. So just to give an understanding that, okay, there are different possible changes. So defect in proliferation migration are different from alteration in the connectivity. Alteration is different, defect is different. That understanding you should be able to appreciate. That is the main concept of this slide. Okay, next slide, please. So because of these diversities, what are the means what we are trying to argue here? The biology and lived experience are the same system. Autistic behaviors are not symptoms of a mutated gene, but they are meaningful adaptive response of a uniquely wired network interacting with the specific environment. So autistic behavior, we are not saying that it is symptom of the mutated gene, but it is because of labeling as a symptom or disorder, something like that. It can be viewed in a different way, like it is a meaningful adaptive response of a uniquely wired network. Okay, the connection is different, so that the person interact with the surrounding in a specific different method, different way. That is understanding. So what happens because of that? They avoid eye contact, and there is a deficit in social cognition. And because of that, an adaptive response to regulate insupportable sensory or informational stimulus occurring. So because of this way of special way of adapting to the environment, there is a change in the contact and change in the social cognition. So what happens? This clinical warning, when you're in the neurodiversity concept, attempting to mask or suppress these adaptive response through forced behavioral conformity actively harms the systemic regulation of the individual, increasing risk of anxiety and depression. That is, if we are not able to understand the difference in connection in the autistic spectrum individual, what happens? We label them as abnormal, and because of that, what happens? They feel suppressed, and because of that, there is a risk of anxiety and depression. If you are able to include them, if you are able to understand their abilities, instead of labeling them as a disabled, instead of viewing this as a disabled, if you are able to identify the ability in them, and if you include them into the part of the society, this possibility of developing a risk of anxiety and depression may be uh, eliminated or may be decreased. That is the concept here. Okay, next slide, please. So next few slides, we will be trying to understand the ability behind the disorder. So autism spectrum disorder, we are, though it's named as a disorder, what are the strength of that individual? What is the ability of that individual? That is the focus of next few slides. So though, as I have already told, the main clinical features of autism spectrum disorder is they have defect in the social communication. They will be having repetitive or restricted behavior, and their processing of sensory system is different, and usually it start in the early development itself. When these features are there, then we usually in clinical setting we diagnose them as autism spectrum disorder. Okay, so as in the next just 2 slides before, we were discussing what happens here. There is an altered connectivity between the brain region. That is the main understanding, and because of that, there is a differences in the social cognition network. So again, another finding what was found is increased local connectivity and reduced long range connectivity in some studies. So these are the neurobiological deficits they find. That is like in case of medical model, these are the things we are focusing. When we come to this neurodiversity model, we will try to find what is the ability behind them, how they, what abilities they are having, in which way they can be functional or they can be used uh, for adapting into a society. So what are the strengths observed in these individuals? They have a strong attention to us, though they having a distractibility for some specific uh, thing in which they are interested. They have paying a strong attention towards it. Okay, they have an exceptional memory of few things or different things which others are not having. They have a pattern recognizing abilities which is lagging in other people, and they have a systematic thinking. These are abilities or strengths observed in autism spectrum people. When we focus these things and when we try to understand or when we try to appreciate these abilities in them rather than finding disability in them, they can be included in the society and they can be used in different fields. Okay, the society, okay, like that, we can use their abilities and we could able to use them for the optimal functioning of the society, and they will also get benefited in that. Next slide, please. So in the ADHD, again, the name itself gives a clinical feature. Attention is deficit and hyperactivity is there. So what is a neurobiological finding in this? There is dysregulation of the dopaminergic and noradrenaline system, reduced activity in the prefrontal network, and altered reward processing mechanism. This is medical concept. That is neurological findings. So what in the neurodiversity, or when we are trying to find what is good in them, they have high creativity. They could able to spontaneously able to solve the problem. They have high energy and enthusiasm within them, ability to think divergently. These things are strengths in the people with ADHD. When we are using them for in this field where these features are required, then they will be able to function normally or even exemptionally good. That is understanding. Next slide, please. In specific learning disorder like dyslexia, the main finding are language processing regions are deficit, phonological processing networks are deficit, visual word from area are deficit. These are medical things. What is the strength behind them? They have very good visual spatial reasoning, creativity, artistic ability. So when we are using these abilities, okay, and try to extract for the functioning of the society, they will be able to function in a better way. That is understanding. Next slide. So just these last three, say we have given some understanding that though we are labeling them as a disorder, they have specific abilities with which they could able to, when we are ready to adapt them in the society, they will be able to function like any other normal individual. That is understanding. So functional disability often arises not solely from the neurological difference, but from the mismatch between the individual and their environment. So what the society is expecting from them. So society cannot expect the same thing from all the person in the all the person, all the individuals in the society. So every individual has their abilities. Okay. So if we are the environment expectation is altered, then they may not be facing disabilities. They may be okay. We may appreciate their abilities and we could use them. That is understanding. Yes. Next slide. So what is there in the environmental and social determinants? So because this environment and social is labeling them as a deficit or abnormal, what the problem these children are facing is educational barriers. So the rigid teaching method labeling them as abnormal, that is one problem they are facing. Because of that, they are not able to learn what they are having, what their abilities is not taught in the class. Lack of individualized instruction, like one individual is good in one thing, the other individual is good in different thing, but the class is taken in a similar manner to everybody so that their education is disturbed. Insufficient accommodation. So these are the educational barriers they are facing. In the workplace, what the barrier they are facing? Sensory overload. Okay. Poor flexibility in the work structure, lack of understanding among the employees. Because of that, because the workplace is not adapting these individuals within their system, they are placing difficulty in continuing their work. That is thing. The social barrier, stigma, discrimination, misunderstanding of the neurodevelopmental condition. So disorder is different, normal variation is different. So thus misunderstanding is there, and because of that, even the functional means they have ability, they could able to provide, do some service to society, but the society is not accepting them. Because of that, they are facing barrier. So these are the environmental and social determinants. because of these barriers, okay, this concept of neurodiversity, okay, is arising as a social model. Yes, next slide. So we were discussing about neurological disorder, neurodevelopmental concept, and neurodiversity. So why these things are important? Whether these concepts, what we are discussing, labeling as a, means if you're labeling A as a B or B as a C, any use is there. How it is going to be clinically helpful, that we are going to see. Next slide. So when we usually what happens, some in the classroom, the teacher will be able to identify that this particular child is behaving in a different manner. You just go and see the psychologist or psychiatrist and try to see what it is. That is usual consultation we used to get. So the parents, when they are when they come to us, they want the early identification. This MChat is one particular one questionnaire where we use for understanding the autism. This corner is one for ADHD, like this. So they come to us for early identification of the problem, and the goal of the parents is, our society is usually, we want to normalize them or mask them. That is the main understanding they come, but that should not be the goal. Early identification is must, but the early identification, by early identification of these individual, we should be able to accommodate them in the class or in the society and building their skills so that they are functional in the society as like any other people. So instead of just like what they used to say, means say is, sorry, classல வந்து படிக்க மாட்டேங்கிறாங்க, அவங்க மார்க் வாங்க மாட்டேங்கிறாங்க, எழுத தெரிய மாட்டேங்குது, நான் நல்ல ஸ்கூல்ல தான் போட்டிருக்கேன், பெரிய ஸ்கூல்ல போட்டிருக்கேன், அவங்க டீச்சர்ஸ் வந்து இந்த மாதிரி சொல்றாங்க. So just by assessing these abilities, we cannot able to say that they are abnormal. So instead we have to find their skills in which they are good. Okay, நல்லா வந்து மியூசிக் செய்யறாங்க, நல்லா ஸ்போர்ட்ஸ் போறாங்க, நல்லா டான்ஸ் ஆடுறாங்க. So like these things we are able to see. Then what happens? The goal is accommodating them and building their skills. That is the main thing. So the reality is early identifications remain critical for improving the outcome and providing support. Okay, rather than the main focus should be like therapy should not aim for passing as normal, which causes psychological harm, but rather focus on physical, sensory, and emotional regulation. Okay, language acquisition, reducing distress. We have to find the ability within them, make the parents understand. Okay, so mark வாங்கல, இதை செய்யல அப்படிங்கிறதுனால வந்து it's not that the child is not going to flourish. They are good in these areas, let us focus on these areas. Okay, maybe somebody will be a visual learner, somebody is auditory learner, somebody will be showing interest in different things. So we have to identify them and we have to clearly form a management plan depending upon that particular child, so that the child will be able to get the skill or improve their skill. That is very important. Fine. Next slide. So as I was discussing, I think you will be able to also appreciate that just a medical doctor or just one assessment, just giving by one medication will not be enough. We have to be work in a multidisciplinary nature. Okay, so medical doctor assessment, psychiatric assessment, and we need to understand the developmental history. Okay, then a psychologist, a clinical psychologist, neuropsychology evaluation, speech and language assessment, occupational therapy evaluation. So this biopsychosocial model, okay, that we have to follow. Okay, then only we will be able to understand their strengths and deficits, so that we will be able to help them in a holistic or comprehensive way. That is very important. So just in one table, one consultation with one doctor, it may not be, we may not be able to serve the child in a better way. It's a multidisciplinary role is required. Yes, next slide. So what is the difference here? Okay, if we are targeting only the medical aspect, okay, target for medical treatment, when we are treating them as a medical model, what happen? the instinctively harmful traits and co-occurring condition. Example, okay, self-injury, epilepsy, severe GI issues, debilitating anxiety. Like the medical treatment is the target is on these medical conditions. When we are targeting for affirmation accommodation, then here the target will be in a non-harmful adaptive autistic trait. For example, non-injurious stimming, intense special interest, avoidance of painful eye contact. So all these things has to be a target. For some of the medical conditions, medical treatment is a target. For some of the psychosocial, uh, psychological and social deficit, then target should be of therapy of affirmation and accommodation. So something we could able to improve by medication and just a medical thing. And for other thing, we require a psychosocial understanding for which we require a therapy. So affirmative therapy respects bodily autonomy while fiercely targeting acute medical sufferings. So both is required. Okay. Yeah. Next slide, please. So we have come to the some means few slides left over. So what we gave what we are understanding by this. So when we are managing this neurodiversity thing. So pharmacological support is required, non-pharmacological therapies are required, and environmental accommodation are required. So all these three things should play a role so that these children could be um, happily or safely accommodated in the society. When they are going for target pharmaceutical support, so for example, okay, for stimulants for ADHD, if any patient is child is having the seizure disorder, we have to treat them. Any anxiety disorders, we have to treat them. The non-formal approach, we have to understand their cognitive difficulties, behavioral difficulties. So then, depending upon that, we have to do the therapies like behavioral and speech therapy, occupational therapy, and if you have to, we have to focus on their autonomy, self-determination. Okay, if they are having difficulty in communicating in a traditional method, we have to make them to communicate to the world in an alternative way in which they are have the ability or comfortable, those things. The environmental accommodation is very important so that we have to reduce the sensory overload to them, understanding their they have some sensory deficits that we have to understand, offering the flexible educational work like the usual educational system they may not help them. We have to tailor made some education system for them, work structures, and implementive inclusivity. So these things are has to be looked into when we are framing the management plan for these children's. So what is the takeaway here? Affirming neurodiversity does not mean abandoning medical support. Wherever the medical support is required, we have to include that. It means deploying it to enhance individual well-being, not to enforce normativity. So just not treating the symptom. Okay, we have to make the person to work in the environment. So that is the thing. So even when we treat in our ward also, so like any in general psychiatry, when we are treating the patient, it is not that if we treat the delusion or hallucination, the person become normal. We have to treat in such a way that the individual has to function in the society like his usual self, or he has to able to live in the society uh, in a in such a way he could able to look after himself and the expectation of the family members. So then only we call it as a complete improvement. Just improving the symptom is not the complete improvement. Fine. Okay, that is the understanding here. Next slide. So it is not the individual who can help himself to come out of these difficulties. It is everybody is having the responsibilities. The clinic consultant, he is having the responsibility. The school and work is having the responsibility. Society is having the responsibility. So together, if the doctors, the social workers, school and work, if everybody work together, we could able to pull that individual we include that individual into our society. That is a main understanding. So for the society, disability rights legislations, anti-stigma campaigns, centering autistic leadership. If these things are promoted, then they may feel less stigmatized. In the clinic, neurodiversity affirming therapy, strength-based assessment is done. Then the individual will be able to cope up with the environmental needs. That is in the school and work, some inclusive educational policies, sensory friendly environments, flexible workflows. If these things are done, then they will be able to identify the individual's skill, and so that they can build their skills for functioning of the society. So everybody has a role in this, not the individual alone. Okay, so everybody should feel responsible to make inclusive of these children within us. Yes, next slide. So these three things are very important for going to the management of this. So understanding the network. So it is a neurological difference are natural. Like we know that thumbprint is there. Okay, every individual's thumbprint is not the same. So it is not that one person's thumbprint is different from the others. So it is not that everybody is abnormal. Understand? So there is a variation. That variation is actually helping us legally. Also, it is helping them. We understood that these variations, everybody's human thumb impression is different. It is unique. Okay, so that is unique. So like that, we have to understand that neurological differences are natural, generative variations, optimizing for survival and topology, not just a broken blueprints. Okay, and we have to honor the expression. The vulnerabilities and strengths are coupled. Behaviors are meaningful response to the environment. Okay, so we have to understand that, and by understanding these things, we have to put that into the day-to-day practice, moving from pathological based cure model to an integrative blueprint of environmental adaptation. Okay, so targeted support and epistemic, so that justice is served to them. So to understand life, we must understand both life in general and specific lives. True clinical excellence lies in accommodating the system, not curing the individual of them. So this is very important. So the true clinical excellence lies in accommodating the system. That is very important, not curing the individual of themselves. Okay, everybody's skill is important. For example, in a operation theater, it is not the skill of the surgeon alone will be enough to get the successful surgery. Okay, the nurse there, the other supporting persons, even the person who makes the environment clean of that supporting person. Okay, if that person is not maintaining the clean and hygienic environment, even after doing a good surgery, the person will develop the infection. So everybody is having a role. As a team only, we could able to help the patient. Like that, everybody's role is important in the society. So everybody should ready to accommodate them. Like it is not like okay, there are many concepts like idlarmun variyar pol. So we should not destigmatize them. We should not make them feel guilt that they are not having the ability. Those things should not be there, right? Okay, next slide, please. So now I think we must have understood that all the brains are not same. Every brain develop the concept of development may be the same, but the outcome of the the structure of the brain, there may be variations between them, either in the connectivity or in the formation itself. There are fundamentally there is a different variations in different individuals. Okay, so if there is these variations are considered as a normal variation, then the function of that individual also will not be the same. It's not the same Xerox. It is a range of emotions are normal, range of behavior are normal, range of uh, thinking are normal, like that. So disability often emerges from friction between the unique cognitive profiles and rigid environments. Okay. So what is the final takeaway message of this presentation? Modern psychiatric care must integrate the hard biological science with a deep respect for neurodivergent identity, shifting our ultimate goal from normalization to compassionate, individualized flourishing. Okay, we have to, okay, we should not think in terms of making them normal. Instead of that, we have to find within every individual, there is some normality, there is some ability, identifying their ability and making that understood to the parents, making them understood to the school environment, making by many awareness campaigns, making the society to understand. Okay, that is a main role is we have to do. I think these kind of presentations, what you are doing from the MSN network is also you are creating an awareness. So many young brains are seeing this presentation, and many people are in getting these concepts. So in their practice, they will be able to use these things, and instead of stigmatize them, they will be able to identify ability in them, and we will be together. We can help the society. That is the main understanding. Okay, I'm sure everybody of you will do this. Okay, next slide, please. So these are some references. Next slide. Next slide. So before I would like to conclude, I would like to give my acknowledgement to my junior faculty, that is Dr. Kirtana. She helped me in preparing this presentation. And I would also again sincerely thank the IMA-MSN network, especially this mental health subcommittee, and the mentor of you all. Also, the participants who were patient enough to hear this presentation. Okay, so I'm sure you must have learned something from this presentation. If any queries, I'll be happy to help you. Thank you for this opportunity.
Thank you so much, sir. It was an insightful session. Any doubts? If the participants have any doubts, you can send in the chat box. I request the participants to stay back, and the G form will be sent in the chat box. Kindly fill that to get your certificates. I call Rishika to deliver the vote of thanks.
Respected speaker, organizing committee members, and my dear fellow participants. I am Rishika, final year MBBS student of Sri Satyasai Medical College and a member of Mental Health Subcommittee, IMA-MSN TNSP. It is my privilege to deliver the vote of thanks for today's session. Before we formally conclude, I kindly request all the participants to remain in the meeting for a few minutes and fill the Google form that will be sent in the chat box to get their certificate. Today's session on brains come in all types, understanding the neurodevelopmental diversity and its clinical implications has been intellectually enriching and clinical relevant. At the onset, I extend our sincere gratitude to our esteemed speaker, Dr. Sivaraman sir, Professor and Head of Department of Psychiatry, Trichy SRM Medical College Hospital and Research Center. Sir, today's session was not merely a lecture, but a true perspective shift. You helped us understand neurodevelopmental diversity beyond labels from a clinical, compassionate, and evidence-based lens. Your clarity in explaining complex psychiatric concepts, your emphasis on inclusive practices, and your ability to connect theory with real-world clinical implications were truly inspiring. Your vast academic experience, contribution in psychiatric researches, and dedication to mental health advocacy are truly deeply valued. On behalf of the Mental Health Subcommittee, IMA-MSN TNSP, we sincerely thank you for generously sharing your knowledge and time with us. I extend my respectful thanks to the patrons of IMA-MSN TNSP, our state leaders, and the entire state team of IMA-MSN and JDM Tamil Nadu for the constant guidance and visionary leadership. Your support empowers us to conduct meaningful academic initiatives and strengthens the professional growth of medical students. I would also like to acknowledge Rehana Tazmin, Head of Mental Health Subcommittee, for her guidance and support in organizing this session. I also thank Parthasarathi, Akash, and our entire technical lead was led by Ashwanta Elumalai sir and all the organizing members of Mental Health Subcommittee for the systemic planning and dedicated teamwork in successfully executing this academic initiative. Finally, I extend my sincere thanks to all the participants of your valuable presence and active academic engagement. We hope that the insight gained from this today's session will be contributed to more inclusive, empathetic, and evidence-based clinical practices in our future professional journeys. With gratitude to everyone who contributed to the successful conduct of this program, I formally conclude today's session. Thank you all.
Thank you, sir. Thank you so much, sir.
Thank you, sir. Thank you, sir. Nice work, team. Nice work. Thank you, zonal coordinator, sir. Thank you, Raihana. Nice organizing.
Thank you, bro.
Yeah, good work, everyone.